lead you into our conversation. And this time we'll be talking about health matters, cancer in particular. And we do this every second and the last weeks of the month. And so we will be handing over to the founder and the chief executive officer of Commod Cancer Foundation, that's Dr. Dennis Ejo, who will be hosting that segment as always. And she will be hosting Professor Samuel Uwale Eyesan, who is a surgeon and an oncologist at the Bowen University Teaching Hospital. She'll be introducing him more as she takes over now. So the floor is yours, Doctor. Good morning, and good to see you again.
Good morning. How are you?
I'm
Very
okay.
well, thank you, Doctor. Good morning.
Good morning, Prof. How are you?
I'm good. Thank you very much.
Good
Thanks
morning.
for having me.
Good morning, viewers. Welcome to another edition of our Key Cancer Awareness. And with Dr. Denise Ejo, the CEO of Commod Cancer Foundation, in partnership with AIT. Together we fight, together we win. Let's have a fantastic conversation today. We're going to be talking about sarcomas. So what's our top topic? Sarcomas in focus. This month is Sarcoma Month, Sarcoma Awareness Month. Let's put it properly. So sarcomas in focus: prevention, detection, and early diagnosis. Sarcomas are rare cancers that develop in the bones and soft tissues, including fat, muscles, blood vessels, nerves, deep skin tissues, and fibrous tissues. Well, my viewers, I don't know what all this is, so I just want to say we've got our guest in the house. Commod Cancer Foundation is looking at how we're going to move this forward. So let's go. Let me first introduce our guest, and then we can come back to other things. Our guest today is Professor Samuel Eyesan, who is a consultant orthopedic surgeon at Bowen University Teaching Hospital, Ogbomoso, and professor of orthopedic surgery at Bowen University, Osun State, with extensive leadership experience, including Chief Medical Director of Bowen University Teaching Hospital, Ogbomoso, and Dean of Faculty of Clinical Sciences at Bowen University. Professor is also the Provost of the College of Health Sciences. With almost 3 decades of experience in teaching orthopedic residents and pioneering the orthopedic oncology in Nigeria. Wow, that's very tongue twisting. Welcome. Thank you for coming and joining us today. Thank you. We really appreciate you. We thank you for your time, and we thank you for making your time available. So before we start this, and before we sit down and relax, let's just give you a big announcement. The Commod Cancer Foundation giveaway of 50,000 monthly is still coming up again in July. And so for those viewers out there, share and let people know how to qualify. To qualify, you must be a cancer patient in active treatment. Help cancer patients get access to the funds, please. So share this information. To participate going forward, follow us, share, comment, and tag so that people have a chance to access these funds. Together we fight, together we win. And thank you to our sponsors of this this giveaway. Okay, so let's go. We're united against cancer. So we welcome you back. Our interview questions start. Prof, are you relaxed and are you ready to go?
Very ready. Thank you.
Awesome. So the first question goes, what are sarcomas and how do they differ from other types of cancers?
Good. Sarcomas are cancers, just like we have other cancers that we call carcinomas. And the way to look at it is this. There are some organs and tissues in the body that secrete glands, fluids, like all in the lining alimentary canal, the stomach. They are called epithelial cells, and because they can secrete secretions. They also have other cells that connect tissues together. We call them connective tissue cells in the muscles, in the bones. When there are cancers of epithelial cells, like all cells that secrete glands, like the breast, like the colon, everywhere, and they develop cancer, we call them carcinomas. But when there's a cancer in these muscles and the bones, we call them sarcomas. That's the way to differentiate them.
That's the best way to differentiate the two. Okay. So with that in mind, and that's the starting point, what are the common types of sarcomas, and which tissues do they typically affect? And more to do with the fact that we don't really know very much about sarcomas. And one of the things I did learn of recent was that it's one of the rare tumors. Exactly. I'm not a medical person, so I always say that it's one of the rare tumors, but it actually is in across many people across the world. So what are the common types and which tissues?
Okay, let us break it down. Let me break it down a little bit for you. In Nigeria, for example, every year we have approximately 100,000 to 150,000 new cancer cases.
Mm-hmm.
What I'm telling you, and carcinomas account for about 95% of it. So only about 1%, in fact, is made up of sarcomas. So if I say 100,000, 150,000 cases of new cancer cases every year, I'm saying that you don't have more than about 500 sarcomas in a year. So that tells you that it's rare compared to carcinomas. So that's the first thing and it affects muscles. We call them, when it affects muscles that are soft, we call them soft tissue sarcomas. When it affects bones that are hard, we call them bone sarcomas. So we have both soft tissue sarcomas and soft tissue sarcomas, broadly speaking. But soft tissue sarcomas are many, close to 50 different subtypes. But the good thing about it is that they all respond the same way to treatment if you get them. And they behave virtually about the same way, but we can subtype to about 50 types. While bone sarcomas are not more than about 15 to 20, but they are bone sarcomas and soft tissue sarcomas. Those are the two different main sarcomas you'll find.
Okay. So the next question I'm going to ask you, therefore, is going to be, how are sarcomas diagnosed, and what treatment options are available for the sarcoma patients?
Yes. The good thing about sarcomas is, again, that they affect surface structures. I mean, skeleton. So you see a swelling straight away. Either you see a swelling on your legs or your hands or your back, and then it becomes painful or may not be painful. So what we're asking is that once you see any swelling or you have a pain in any part of your body that is unusual, it should set alarm and should go and seek medical consultation, because you will catch them early if you see them, and then you can do some tests to see whether they are actually malignant, or whether they are benign, whether they are bad or they're not bad. But first of all, you need to, immediately you see any swelling, don't go anywhere else, because we find out that a lot of people go different places. They come to the doctor last. So early presentation, like in every other cancer, is a mainstay of treatment. Come on time, because you will see a swelling and you'll have pain. Those are for early presentations.
So what are the treatment options? Is it?
Oh yes. First of all, you have to make a diagnosis. So you will, of course, take a biopsy, and good enough, biopsies are easy. Needle, and you take your samples, send to the histology lab. It comes back, tells you whether this is type of sarcoma it is, whether it's soft tissue. They can take X-rays. If it's in the bone, it will show. Then you do MRI. After MRI, of course, but you must make a tissue diagnosis. and going to make a tissue diagnosis to take part of the specimen, send it to the lab for histology. It comes back, then of course you know that this is cancerous. This is the type that you're looking of, and of course you can now tell you how to treat it. The treatment is multimodal. You use both drugs, you use radiotherapy, you use chemotherapy, and we use surgery. The three of them go together for sarcomas. And we've gone a long way in sarcoma treatment in Nigeria. It's like we always say, cancer is not diagnosis of a cancer is not a death sentence. If you pick it up early, you can cure it. Both soft tissue sarcomas and bone sarcomas. And we don't if you get them early, we don't amputate anymore. We can conserve the limb. We can remove the sarcoma, either bone or soft tissue, and we can change that portion of the bone and put what we call a prosthesis. It can work normally if you catch you early. It's when you come late, then it leaves the local site and then spreads to other parts of the body through the bloodstream. And of course, it goes to the lungs, can go to the brain, can go to everywhere, and then becomes dangerous. That one becomes a late-stage cancer, and that's it's difficult to cure. And sarcomas are much more, although they are rare, but are much more difficult to manage compared to carcinomas. So it's important that early presentation must be sought. And we also plead with our colleagues, because some of them go to our colleagues and they keep them for a long time, and doing all other kinds of investigation, and in fact they make some other minor operations on it and worsen the picture when it comes to us. So it's important that once you see it and you know that this is unusual, send to the appropriate doctor. A proper referral is very important. It's also treatment. If you refer early, it's treatment, and the patient will thank you for it if it goes to the right place so that you can deal with it.
Oh, that's interesting when you look at it from that perspective, because there are very many of us that don't know what sarcomas are, and we don't really understand it, but all we see is the lumps, because I now understand sarcomas are normally the lumps you see around. And so when I'm looking at what you're saying now, it's just saying to me that, okay, if we get it early, we're going to have the same cancer treatment as you would get normally with other people. We would get the surgery, we would have the chemotherapy, and if need be, we would have the radiotherapy. And with that, on an early diagnosis, we're saying that the chances of survival is very high. So that's the message we're trying to get on. Okay, so that gives a lot of hope in the midst of the cancer storm. So therefore, with that, you keep going on to this early diagnosis and treatment of the sarcoma disease. So now I want us to emphasize or talk more closely on its importance to the everyday person.
Sure. Like in all cancers, prevention is very important. You can prevent it. We'll talk of primary, secondary, and tertiary prevention. Primary, like name implies, you want to get the cancer even before it occurs. And secondary, there are some tests you can do when they come in early, and you can catch it. When you do those tests, you can screen them and pick them up, and you can treat the patient appropriately. And the tertiary prevention is, of course, the one we have been talking about since. Patient that has the cancer already. We don't want to get to that stage. We want to be able to get the cancer before it happens at all. So we know that there are some risk factors in cancer, and cuts across all cancer, not only sarcomas, or even carcinomas. There are what we call factors that you can't influence. If you are old, you are old. There's some cancers are more in elderly than in young people. So those factors we cannot control, but we can control some risk factors. Like we know, like in carcinomas, even in sarcomas, smoking is not advisable. Drinking alcohol in large quantities is not advisable. You also must know your family history. If you things in your family, because this is runs in they run in families. So if your parents have had it before, you must know that you stand a 50% chance of having it. So when you see anything around your body that is unusual, you should seek treatment consultation immediately. And of course, we'll talk about exercises. The standard, because you do a regular controlled exercise program, your body generates a lot of chemicals during the exercise. We call them antioxidants, and they are able to deal with all cancerous tissues in your body and prevent them from progressing into cancer. So exercise, a regular sustained exercise program will generate these antioxidants and can, if there are anything, chemicals in your body that we call free radicals, you can mop them up and you can excrete them either in urine or stool, and so you don't have the cancer. So that's very important. And then it's also important that you must do regular screenings, especially if you do a regular checkup every time in your body, maybe twice a year. Even you may see a swelling somewhere, and the doctor may just pick it up and ask you, when did this one occur? You say about 2 or 3 years ago. Is it getting bigger? It's not getting bigger. So they can follow it up for you. So regular screening or regular medical tests will also help you to find those cancers early and treat them. So it's important to know that if you are overweight, you can also develop these cancers. Because when you're overweight, then there are a lot of metabolic activities going on in your body that can also stimulate these cells to grow uncontrollably. So it's important that you must also control your weight. We know that almost all cancers are increased in people who are overweight. Same with carcinomas. Weight is dangerous, so you must cut it down. And that again, you must also watch what you eat. Even the food we eat, very important, because we know that diet is one of the mainstays of cancer management before it. Vegetable diets, nuts, cereals, all have chemicals that also help in fighting cancer cells before they occur in the body. And so it's important that you must eat rightly. And all these fruits contain antioxidants also, and helps to prevent cancer formation in the first place. So these are things that you need to look at all the time and do regularly so that you prevent yourself from having cancer at all. And for those who now have risk factors, for maybe genetic risk factors, and that you can trace family lines that have it, you must go regular for regular medical checkups and get screened and can prevent this cancer.
Okay, so based on what you're saying now, we're now very clear that one of the things that I've picked up from this conversation now is the fact of the importance of knowing your own medical history. And that's something that we have to recognize that is not very common in our part of the world, because we do not actually even go for the checks yearly, talk less of going to find out our family histories, which is very important if we're going to make a difference. And that makes a significant difference in where we're going and how we're going to move this forward. So I'm going to ask you, so when we look at the risks associated, what are the risks associated with developing sarcomas?
No, come again, please. I didn't get you clearly.
Yeah, I'm going to go again. What are the risk factors associated with developing sarcomas?
Oh yes, radiation, for example, is a major issue. Either even for the treatment, as we treat cancers with radiotherapy, but radiotherapy itself can also cause cancer. But when we balance the risk of the treatment, you get what you gain in terms of treating with the radiotherapy and the risk of developing cancer from treatment of a therapy, we think the benefits far outweigh the risks. So radiation is something we watch. That's why most times those people work in radiation areas are protected. There's a limit to the amount of radiation that they must have every year. Once they exceed it, then they don't go for to work again in those areas. Again, radiation. This was found. This was discovered after the World War, when they are in Japan, when they found out that most people who were exposed to the nuclear bombs developed cancer afterwards. So that's why it's important to make sure that you don't expose yourself to radiation too much. And you also must. It's very important also that even those who are exposed to radiation, for example, I have a patient now who had a sarcoma 15 years ago, and 15 years ago, and he had radiation, had surgery, had chemotherapy, and he has been free, disease-free, for the past 15 years, only to develop cancer now in the surrounding area, which I'm thinking is as a result of treatment of radiation of cancer. But if you have been disease-free for 15 years, I think then you have done very well in terms of that. So radiation, chemicals, for example, pesticides, and there are some ones we call herbicides, for example, that are used in treating fruits or that you harvest. They have been known to also cause changes in cancer cells, and especially, and also again, there's some viruses.
That communication won't give lecture law.
Epstein virus, for example, can cause sarcoma. Kaposi sarcoma, for example, is caused by herpes virus, herpes 8 virus, and we know that some other viruses can also cause sarcomas. So you must know those infections, like from viruses. You must know the chemicals that can cause them, and you must know also that radiation can cause them. So once you know those things, you avoid overexposure to those things. People, especially in carpentry, for example, there's what we call there's a pesticide that prevents woods from getting bad. If you use those ones and you are exposed to them for too long in those industries, you can develop sarcomas. So 3 major things: environmental factors, radiation, viruses, and chemicals. You must prevent. You must guide against, and you must take those histories from patients when they come, whether they worked in such places before, and if they work in such places, let them know the risk involved, so that they will abstain from working in such places.
Awesome. And so before we end this segment of this program, I want to ask you one question, and this question has 3 parts to it. What would be your 3 takes away from this? So I want you to give a word to the government, a message to the NGOs, whatever you want them to do, NGOs, social groups, charities, everything, and a word for patients.
Let me start with the patients first. Present early. As soon as you see anything unusual in your body, see the doctor. Don't go to our other brothers across the divide. Don't over pray. Pray and come to see your doctor for the patients. For the doctor, for the government, I think they're doing quite fine. I remember 20 or 30 years ago when we started this, we were amputating almost all limbs with sarcomas. 20 years ago. But the government has trained a lot of us. I was trained by government, and capacity has been improved considerably. And now I can tell you that we, in the last year, for example, those managing sarcomas, we were able to save close to 30 limbs and gave them prosthesis, gave them chemotherapy, and then, of course, they are working and they're doing fine. Government is trying, but they can still do better, because we know that most times, but funding is a problem. But as I know, the government is doing a lot of things now. They are trying to start 3 cancer centers across the country, and with all specialties are going to be practiced there, and they're trying to fund it. They're improving their radiation therapy, which is good. So on the side of the government, they are doing well and they can do better. And on the side of NGOs, talking like this, continue to talk like this, send this information out. Let them know that this thing exists, so that they know, the patients know and access and where to access treatment when they have this problem. So for the NGO, just keep talking, keep passing information, advocating. It's very important that you do this. Thank you very much.
Thank you very much, Prof, for your time. Thank you for coming on. I would like to say it's been great, and I mean, I didn't know very much about sarcomas, and I'm now understanding a bit more. And I think that maybe a lot more discussions will have to come up on this. But this month is actually Sarcoma month, Sarcoma Awareness Month. So I will remember to put up my flyer. I forgot about it, and I found a fact I want to share. So I want to thank you very much for joining us today on this program and for giving us your time. So let's look at it. Next time, who have we got? We've got the Professor Adiji, who is from the University of Maiduguri Cancer Center, and he will now be telling us more about what is happening in the new technologies and the new spaces. Like you just said, more cancer centers are coming up, and so we should actually learn to know where they are and start to use them. Together we fight, together we win. So, Prof, I want to say once more, thank you very much for your time. We really appreciate you. To all our viewers, we want to thank you for coming on and being part of this. We tell you, together we fight, together we win. Follow us on our social media pages, which are Commode Cancer Foundation. We have our Instagram, Facebook, LinkedIn. I think it's all over the place. I don't know. So you can actually follow us on any of them and get involved. Please share the information to our people, those that need it. Anybody that needs to participate in the giveaway, it will be sometime in July. It's 50,000 naira to a cancer patient in active treatment. We look forward to seeing you again in 2 weeks. And thank you once again for joining us. Have a fantastic week. Thank you, Prof.
Thank you very much.
We appreciate it. Thank you.
Yes. Thank you.
Thank you very much, Dr. Dennis Ejo there, and that concludes the discussion on sarcoma.
Our message is very clear. Together we'll fight, together we win.